What is the difference between cone biopsy and LEEP for cervical cancer? Imagine you're trying to catch a small problem before it becomes a big one. That's what doctors do with cervical health. When abnormal cells are found on the cervix, they often need to be removed or examined more closely. Two common procedures for this are cone biopsy and LEEP. Both aim to remove abnormal tissue, but they do it in different ways and are suited for different situations. A cone biopsy, also called conization, involves cutting out a cone-shaped piece of tissue from the cervix. This method removes a larger, deeper section that includes some of the cervical canal. Because it takes more tissue, it provides a detailed sample for diagnosis and helps determine if there is any early cancer present. It is usually performed in a hospital or surgical center under general or regional anesthesia, which means the patient is either asleep or numb from the waist down. The procedure can take about 30 to 60 minutes, and recovery typically lasts from 2 to 4 weeks. During this time, patients might experience some bleeding or discomfort. Cone biopsy is often recommended when high-grade precancerous changes are suspected or when previous biopsies have been inconclusive. It's also useful if there's concern about early cervical cancer because it allows for a thorough examination of the tissue. On the other hand, LEEP, which stands for Loop Electrosurgical Excision Procedure, uses a thin wire loop that is heated with electric current. This loop is used to shave off abnormal tissue from the outer layers of the cervix. LEEP is less invasive and usually performed in an outpatient clinic under local anesthesia, meaning the patient stays awake but the area is numbed. The procedure is quicker, taking about 10 to 20 minutes, and the recovery time is shorter, often 1 to 3 weeks. Because LEEP removes a smaller, more superficial section of tissue, it is mainly used for moderate to low-grade precancerous changes, such as cervical intraepithelial neoplasia grades 2 and 3. It's effective for treating abnormal cells detected during screening tests like Pap smears or HPV testing. When considering risks, cone biopsy has a slightly higher chance of complications like bleeding or affecting future pregnancies. Since it removes a larger part of the cervix, there's a small risk of cervical weakness, which could lead to preterm birth in some cases. LEEP usually has a lower risk of bleeding and tends to have less impact on fertility, but pregnancy after LEEP still needs careful monitoring. Both procedures requiring follow-up with Pap tests and HPV testing to ensure the abnormal cells do not come back. In terms of effectiveness, both procedures are highly successful in treating precancerous lesions and early-stage cervical cancer. Studies show that when the margins are clear, meaning no abnormal tissue is left behind, recurrence rates are similar. However, cone biopsy may be preferred when a more extensive tissue sample is needed for an accurate diagnosis or if the lesion is suspected to be more severe. In summary, cone biopsy is a more invasive procedure that removes a larger, deeper piece of tissue, making it suitable for more serious or uncertain cases. LEEP is less invasive, quicker, and mainly used for moderate precancerous changes. Both are valuable tools in cervical cancer screening and early treatment, and the choice depends on the severity of the abnormality, the patient's future pregnancy plans, and the doctor's clinical judgment. Always consult with a healthcare professional to determine the best approach for your individual health needs.